Good morning, guys. Today I will be talking about what a disc herniation is, the classifications, and basically about disc herniations. So, disc herniation is nothing but something that occurs when there's a tear in the annulus fibrosus of the disc, and the pulpy material called the nucleus pulposus inside herniates through the annulus fibrosus and can compress on the nerve roots, resulting in sciatica and radicular pain and stuff. So coming to what a disc bulge is. Before we go ahead with herniations, I'll just tell you what a disc bulge is. So as you can see here, the disc bulge means that the entire backside of the disc is protruding, which means it's a uniform protrusion. There's no localized part of the disc which is sticking out and compressing any. It can compress nerve roots, but this rarely occurs with an isolated disc bulge. It's an even protrusion. You can see here there's no part of the disc which is sticking out more than the others per se. So it differs from the disc herniation in the fact that it's a general outpouching of the entire backside of the disc, and typically it is not a cause of low back pain unless there's an associated annular tear along with the disc bulge. So disc bulges are very common in pain-free middle-aged folks, and as you can see in the diagram here, this is an example of a normal cut of an axial section of the MRI. See, the disc material is nicely contained within the vertebral body. But here you can see there's a generalized outpouching of the disc material, and it's clearly seen that this is called a disc bulge, and it's compressing on the spinal cord. So for example, in a landmark study done by New England Medical Journal by a person called Jensen et al., they just did an MRI in a random population of people, 98 middle-aged volunteers, and they found that 52% of them had a disc bulge. So that's an interesting thing to know. So we ourselves might have disc bulges, but we wouldn't be affected by them because we would be asymptomatic, like I said, unless there's an associated annular tear. So coming to the classification of disc herniation, there's a morphological classification, and then there's an anatomical classification based on where the disc protrudes. So coming to the classification, a herniation is usually divided into a protrusion, an extrusion, and a sequestration. A protrusion, also called a contained or a subligamentous herniation. So it's usually an eccentric bulging of the disc with an intact annulus. The annulus is intact. That's the keyword we're looking for here. You can see the outer portion of the annulus should be intact. So as you can see here, this is within the annulus, and this has gone till the outer layer of the annulus. These are both protrusions, as the outer layer of the annulus is intact, and this black structure you see here is the posterior longitudinal ligament, and the posterior longitudinal ligament is also intact in case of a protrusion. Coming to an extrusion or non-contained or transligamentous herniation, disc material herniates through the annulus but remains continuous with the disc space. What this means is, so extrusion also you can be divided into three. It's a covered extrusion, which means the disc material is protruded out through the annulus, but the posterior longitudinal ligament is still intact. So it is a subligamentous. Transligamentous fragment is when the disc material has come out to the annulus and the posterior longitudinal ligament. And finally, the sequestrum occurs when there's a loss of continuity between the disc space material and the material which is herniated out. So you can see there's a loss of continuity, whereas in an extrusion the material is still continuous with the area where it's herniating from. Okay. So sequestration is when it herniates with the annulus and is no longer continuous with the disc space. And what happens is, in a case of a sequestrum, this material can herniate either caudally or cranially. So this is an example of a sequestration in an MRI sagittal section. You can see here there's loss. This is the material which is in the spinal canal, and you can see it's separated from the original disc material, and this is how it looks on an axial section. And you can see it's migrated chordally after coming out from the this is the L3 L4 body, so this is the L3 L4 disc, and it's come out and it's separated from the original space from which it's been herniated. Okay, coming back to your location classification, there's a central prolapse, there's a posterolateral or paracentral prolapse, and a foraminal, and the last one is far lateral or extraforaminal. Axillary is just another thing which I'll talk about in another video. So according to the location classification, a central prolapse patients with a central prolapse may present with patients with a central prolapse may present with cauda equina syndrome, because there's a compression of the spinal canal and there's reduced space in the spinal canal, and also it directly compresses on the dural sac. As you can see, the disc material is herniating evenly and it's purely central. Second is the posterolateral or the paracentral. You can see this occurs, if this is a clock face, this occurs in the 6 o'clock position. A paracentral will tend to occur in the 5 or the 7 o'clock position. You can see this is the right side and this is the left side in the MRI. So this is a left paracentral herniation. Why paracentral herniations are the most common, 90 to 95%, is because the posterior longitudinal ligament is the weakest in the paracentral area of the disc, which is here and here, and this usually affects the traversing nerve root. So what is the traversing nerve root and the exiting nerve root? I'll just show you. So imagine there's a herniation of the L4 L5 disc. You can see here, if there's a herniation of the L4 L5 disc, it can compress the traversing nerve root in the paracentral region. You can see this is the central, this will be the paracentral region. Paracentral region will be compressed here, and this is the traversing nerve root. What is the exiting nerve root means? So in an L4 L5 disc, the L4 nerve root will exit through the foramina, whereas the L5 nerve root will pass downwards and exit through the next foramina. So at an L4 L5 disc level, the L4 nerve root will be affected in a foraminal disc protrusion, and in a paracentral disc protrusion, the traversing nerve root of the will be affected, which is L5. So in L4 L5 disc, the L5 will be the traversing nerve root and the L4 will be the exiting nerve root. I hope that's clear. So in a foraminal protrusion, you can see this is the central portion of this will be paracentral, and this is a foraminal. You can see this is around the 8 or the 4 o'clock position depending on the side, and this usually affects the exiting nerve root more than the traversing nerve root. So the herniation at L4 L5 affects the L4 nerve root, like I showed before. Okay, this is an example of the sequestrum I showed you. So what would this be? Would this be an extrusion or a sequestration? And according to the anatomic classification, what kind? So this would be an L4 L5 disc paracentral extrusion. Extrusion because this material is still continuous, and obviously the posterior longitudinal ligament has been ruptured here. It's pretty clear. So it's a transligamentous extrusion paracentral, left paracentral. This will be the right and this will be the left. So to add to this, in Campbell they've given a few more points where, according to Campbell, a protrusion is a focal or asymmetric extension of the disc beyond the interspace with the base against the disc of origin broader than any other dimension of the protrusion. What they mean by this is the base of the protrusion, the dimension is bigger than the material which is actually herniating out. Whereas in an extrusion, there's a more extreme extension of the disc beyond the interspace, and the base of the disc of origin is narrower than the diameter of the extruding material. So what they mean is the base is narrower and the extruding material is wider. So this will be an extrusion according to Campbell, whereas here in our protrusion you can see the base is wider than the material extruding out. Alright, that's all about a disc herniation. Thank you. See you in the next video.